That's fun. So nervous. Dude. But we're not even recording yet. I know. Or are we? Or are we?
What's up, guys, and welcome back to another episode of Health Yes. Here at Cameron County Public Health, where we talk about all things public health and more. I'm your host, Javier,
and Andrea Gomez.
Joining us from our very own clinical services, Immunization Coordinator Brianda Montoya.
This month, Javi, we celebrate National Immunization Awareness Month. And I know, another episode of vaccines. Well, not really. We're here to talk about what's behind the curtain, what's going on in the department, and she's going to give us the scoop on just that.
Awesome. Welcome to the show.
Thank you for having me.
Yeah, of course. But hey, Javi,
Yes.
Brianda, before we start, could you tell us just a little bit about yourself and maybe a little bit about the clinical services program and your experience with it?
Yes, so as immunization coordinator, I work under our clinical services program. And in our division in clinical services, immunizations is one of the bigger portions. We mainly work with our providers in Cameron County as the immunizations team, but our clinic sites also provide immunization services.
Nice. So we're here to talk about immunizations, right? Why is it even important to keep talking about immunizations? Why are they so important?
Vaccines, as we know, protect us all. And I think it's really important to raise awareness on this, not just now, but always. Vaccines not only protect health of yourself, but also everyone around you. Access to vaccines is available, and that's what we're here to do in Cameron County Public Health. Make sure that we share that awareness and provide resources for our families.
And I think it's also important because immunizations, it's such a huge part of our department and what we do and what we promote even as community engagement and on social media. So I think that just having a space in which we dive maybe a little deeper into the importance, right, I think is essential.
Definitely. So right now we are in full back to school mode. We're teaming up with local schools to make sure families in Cameron County know all about vaccines that can help protect kids and students, not just the ones that are required at the beginning of school. So that includes like HPV vaccine, which is not a school requirement, but it does add that extra layer of protection for our community, and specifically in our youth. And our goal is to give parents the information that the best of the information that they can to make the best choice for their family.
Okay.
Gotcha.
Wow.
And in what way are we providing that information for them?
So we participate in outreach events through our community engagement team, but also as the immunizations team. We are collaborating with providing health campaigns as we move forward into National Immunization Awareness Month.
Which is this month, right? August?
Yes, every August. Every August, we celebrate National Immunization Awareness. And so we look forward to it every single year.
Wow, that's nice. And I know that our department has been pretty busy, right, this month, not just with immunizations, but with everything. So what steps are we taking for our providers and community right now? Because I know you mentioned that you work closely with providers. So what steps are being taken?
So specifically in August, the immunization team, along with our other programs here in Cameron County, we put together an immunization and preparedness conference every year, and this is geared specifically for our providers in Cameron County. So we bring together our team of healthcare providers, schools, nursing staff as well. And so this conference, we always want it to be just kind of a large networking opportunity where we also share resources, we address immunization gaps and concerns that we often see in, or private clinics see in day-to-day offices, and as well in our clinical sites too. So it is a little bit of everything, but we are really excited about hosting it this year. So that's something we have to look forward to.
Wow, and this is exclusively for providers, correct?
That's right. Yes. So we make the effort to reach as many of our Cameron County providers. We also help put this together with, of course, some of the experts in our field too. So we're really excited for our speakers this year as well.
Wow, and does this conference that happens annually, right? Correct me if I'm wrong?
Yes.
Does it help update providers into what's happening in the now? Or any trends maybe?
Yes, and any changes that happen throughout the immunization schedules that come out every single year, and of course, changes as they come.
So you mentioned back to school season is here. What would you say is a tip that you would like to give parents for their kids before they head to class?
So my biggest tip is do not wait until the last minute. Check your child's immunization record now. Many parents are surprised to learn that their child may be due for a booster shot before starting school or before starting a new grade level. And so checking early means you get to avoid the back in school rush, which a lot of our clinics are seeing around Texas right now. And of course, keeping your child protected from preventable diseases starting at the very beginning of the school year.
Gotcha. And with it being back to school season, I know everything's primarily focused around kids. Sometimes people would think that it's, immunization is just for kids. What about adults?
So for adults in Cameron County, we do have a program called the Adult Safety Net, or ASN, and it offers vaccines free of cost to adults who do not have health insurance. And so that includes vaccines such as the tetanus, hepatitis B, and a few others. And we provide those here at our clinics, and we do have ASN providers throughout Cameron County as well.
What's one thing our providers might not know about what we're doing to support them?
So the immunizations team here at Cameron County, we go out to the clinics, we train their staff right where they are. We help with things like vaccine storage and handling, record keeping and MTrack, and that way providers can focus on patient care and they know they're following all the right steps. And our team is always here to support. We often see providers twice a week, once a month, as often as the support that they need it. Our immunization team is small but mighty.
So you mentioned something right now, Brianda, about MTrack. Could you expand a little bit on that? Because I think it's very beneficial for people to understand what it is.
Yes, so MTrack is the Texas Immunization Registry, and this is statewide. So whenever you walk into a provider office, pharmacy, even school-based clinic, and you would like to receive a vaccine, the idea is that they enter this information of vaccine that you received and to provide your medical record on MTrack. But it is really important because as we grow up, things change, right? We often move. Sometimes we don't necessarily keep paper trails of records.
Right. Who even has their vaccine record?
Even just the record keeping here alone. I mean, I remember back when I first started working here, there was nothing but binders of information and stuff.
Yeah.
So making that switch
so we're
to digital.
we're slowly kind of shifting towards digital.
Yes, and MTrack is very accessible. So they are able to keep all your vaccine records. We're able to even add historical data. So let's say our adults in Cameron County that didn't have MTrack available to them when they first initially received vaccines, we're able to add historical data on there. And I think it's important for our listeners to know that if you received immunizations after the age of 18 and you were wanting to trace back your record, sometimes it isn't always available. So you need to make sure to consent to keep your information on MTrack.
That's what we need from the people, basically. Consent.
Yes.
Wow.
And that could be easily done. Walk into one of our public health clinics and we can assist with that.
Hey, and what are our 4 locations again?
So our 4 locations for Cameron County Public Health is San Benito Public Health Center here in our San Benito Annex. We have the Harlingen Public Health Center located out of Harlingen, Texas. Port Isabel Health Clinic We are open on a limited basis in that location.
Right.
So it's important for
small
anyone
but mighty,
interested,
though. Small but mighty.
To follow up with our clinic staff to get an appointment or find out which day will be available. Services will be available.
Right.
And Mary Pay Lucio Clinic in Brownsville.
I know there must be so much information out there about vaccines, but what do you consider to be a surprising fact that you wish more people knew?
I really wish people knew that your vaccine protects more than just you. It protects the entire community. And so not only are you, when you're choosing to be vaccinated, not only are you protecting yourself, but you're protecting older adults, you're protecting babies, and you're protecting the vulnerable in our population that cannot get vaccinated for health reasons. And so your decision to be vaccinated could be the reason why someone else stays healthy.
Oh, that's beautiful.
Vaccinations are the key to the future. And speaking of the future, looking ahead, what's next on the immunization horizon for our department?
So we really are working on expanding our reach and our help in immunizations. So we're working with partnering with schools. And so in partnerships, we really want them to be able to host vaccine events at campuses. Because I really do think this is the best way to collaborate with school districts. And these partnerships, what they'll do is make access to vaccine easier for families, for students. As we get busier coming into our school year, we really do think that this is going to be the strength. So right now, we do have 2 school districts in Cameron County on board.
Nice.
And we're really excited that they provide vaccine at their student health services campuses and offices. So
And that must be so convenient, right?
it really is. It really is. We hear so many great things coming from our partners. And so we really want to push on expanding that.
Nice. I know there's another really, really cool thing that we've been working on over the summer regarding immunization, and it's
That's
our
right.
HPV campaign, which we had amazing feedback before the summer started with our school health advisory councils. And I feel like I don't know about you, Brianda, but I felt like the feedback from parents was incredible. And I cannot wait to just jumpstart now that school started again.
I think so too. So I touched on this a little bit when we first started our conversation. So vaccines, there are vaccines that are not just required for school. There's some that fall under our recommended. And so we really push these vaccines for, again, the protection of our community and protection of youth and the most vulnerable population. So our HPV campaign that we are launching in partnerships with school districts in Cameron County is to push not only cancer prevention, but also education on vaccines and address vaccine hesitancy, miscommunication.
Which there is a lot of down here.
Right. And just connecting young adults and their parents. We do think that vaccine can bridge that communication and where we all get on the same page on what is best for not only ourselves, but for families.
Well, Brianda, thank you so much for taking the time to stop here and talk to us about immunizations. I know what a busy schedule you have, especially it being the month for immunizations. But most importantly, for your dedication and commitment to our listeners and our community.
Thank you all. Thank you for listening.
And speaking of our listeners, thank you to everyone listening out there to another episode of Health Yes. Make sure you follow us on Facebook, like us on Instagram, subscribe to our YouTube channel. Make sure to get those notifications on so you don't miss another episode. Especially on Spotify. Look us up at Health Yes so you never miss an episode. Remember, stay safe, stay healthy, and keep immunizing. And we'll see you on the next one.
Bye.
Bye-bye.
We did it.
Woohoo.
That was so scary.
No, it wasn't.
I'm scared.
I'm scared. Now.
What we gotta do is Spanish.
I know.
The podcast.
Yep.
Wait, we do it?
Yes.
Oh, wow.
Yes.